Hey guys, have you ever wondered why people have such weird and funny reactions under anesthesia?
My eyes are thirsty. Give them a drink.
They're thirsty?
Yeah.
Well, my name's Dr. Maddie, I'm a doctor from the UK, and today we're going to find out.
When they were giving me that shot for my leg, I think he tried to touch my wiener.
I don't think so.
No, I don't think anyone tried to touch his wiener unless he was being catheterized for the surgery. And this is pretty common, but we tend to do it whilst you're under the general anesthetic to help reduce any distress. Of course, we do it with consent.
They don't do that.
You got really close.
Shh. Well, it's because that's where your nerve is. It goes right over your hip bone. No, it goes right over your hip bone.
Okay. I'm really glad you didn't.
So again, no, there are no nerves that need to be injected in your wiener for surgery. I think what he's had here is a nerve block. Now this is where they inject one of the nerves at the top of the hip to basically give some pain relief down the limb, and we normally reserve these for things like orthopedic surgeries if we're having to operate on bones and we're anticipating significant pain post-operatively.
Do I have clothes on?
Nope. Naked as Jaybird. Better just stay under that blanket.
Should I have clothes on?
You will. You will. Don't worry.
So yeah, we ask you to take off all of your clothes before you have surgery. For obvious reasons, we need things to be exposed. There's no point in us doing an appendectomy if you've still got your jeans and your belt done up. But we do give you one of our gowns just to make sure to put it on the right way round. Otherwise you could give everyone on the ward quite a scare.
Have you ever played Twister?
You mean Twister with the dots on the ground? Yeah, it's a great game.
Your phone looks like Twister.
You're right, it kind of does.
You can't play Twister on your phone, it's too small.
You're right.
Again, it's not uncommon to see simple hallucinations with a general anaesthetic, as opposed to more complex ones where you're seeing people walking around. And also the slurring of his speech is as a result of the muscle relaxants still flowing around his body. It might take a few more hours for that to wear off. No Twister for him in the meantime.
Have you ever had ice cream?
What's your favorite kind? Is chocolate your favorite?
No.
Caramel?
That's not a flavor.
It is.
That's something you put on ice cream.
So yes, generally after surgery, we ask you to have a soft diet, either of things like ice cream, milkshakes, or yogurt. And we tell you to eat something soft because they don't require a lot of chewing, because you might still be quite numb and we don't want you biting your tongue or your cheek. Also, you're going to want to avoid hot foods and beverages because this can increase the swelling as well as bleeding by causing the blood vessels around the area you've had surgery on to get bigger and leak.
What does that say?
It's just the names of all the nurses that are working right now.
Whose last name is Newswanker?
Newswander.
Oh.
Newswanker. Yes, that would be an exceptionally unfortunate name to have as a doctor. Almost as unfortunate as my GP's name, which is Dr. Payne.
Oh man. Can you scratch my nose? Okay.
And an itchy nose is actually pretty common. It's thought that it's related to the opiate painkillers that you have when under the anaesthetic. Now, this can cause a generalised itch around the body, but for whatever reason, it localises in the face and at the tip of the nose. Don't ask me why.
My stomach be bubbling.
Oh, see, I heard that's what you said.
Every time I eat, it bubble, and I gotta go shit. I'm tired of shitting. I will shit every
She is a very respectful girl. She's never cursed in front of me like this.
I'm tired of shitting this.
Oh, bless her, she's been pooping excessively. But it's really unlikely that this is as a result of the general anaesthetic. Rather, I think it might be due to one of the pre-medications she's needed for this procedure. Now, for some of our patients who have a colonoscopy, we need to give them a really strong laxative, which has to clear out the whole colon to allow you to visualize the colon when you go in with the cameras. Unfortunately, some people, this can affect very severely. Piece of advice, if you ever have to take it, stay near to a bathroom.
No, God! No, God, please, no! No!
I am a pre-med student.
We know that.
I have to make it. Black excellence.
Okay, now shut up, girl.
Okay.
Oh, bless her. She's a medical student too. That must be so embarrassing. I remember once being a patient at my local hospital where I worked, and I had to be catheterized by one of my female colleagues. We never really did look at each other the same way after that.
Are you still passing gas?
I can't. Oh.
Clear out the way.
I'm like the Hulk. My asshole burning all night.
Oh gosh, I thought there she was having a seizure for a minute. But no, she's just trying to fart. And the reason that they're asking this question is because they want to know how well the bowel is functioning. If you're still passing gas, it tells us that your bowel is still working and that you haven't got what's called a bowel obstruction or a blocked gut. And interestingly, for some of the surgeries that I used to be involved in, we'd really want you to have opened your bowels and passed urine before we let you go home.
I'm hungry.
We know.
My lips dry. I'm quenched the thirst.
We know, baby.
Okay, I want some water.
I'm gonna take you and get you some mashed potatoes.
What else I can eat besides mashed potatoes?
You gotta.
So, yes, she is hungry. And to be honest, that is expected. Normally, we starve our patients 12 hours before the surgery. So if you've had a 5 to 6 hour operation, you can imagine you've gone without food for some length of time.
Oh, Sam. I can't recall the taste of food.
And the reason we ask you not to eat anything before surgery is to reduce your chances of vomiting when you're going under the general anaesthetic. Now, what can happen if you do vomit? It can go down into your lungs and cause a really harmful pneumonia that we call an aspiration pneumonia. So I know you're going to be tempted, but please do not eat.
Something, but just nothing spicy or something that's gonna.
Oh no, I don't want my asshole can't burn no more. Oh no, Miss, I love pickled eggs, but I will not. You know what pickled egg is?
So what are these pickled eggs? Let me know down below if they're worth trying.
Man, you are eye candy. Are you a model?
I'm your wife.
You're my wife?
Yeah.
Holy shit!
Ah, that's really sweet. So he can't remember that this is his wife.
Wait a minute! Who are you?
But short-term memory loss is actually quite a common side effect of a general anaesthetic. It tends to be short-lived in the majority of cases, but believe it or not, in very small cases, rare cases, it can be long-term.
Oh no, my eyes. They in 3 different. Wait, do I have 3 eyes? Hey, doctor.
Jordan.
Doctor.
You have 2 eyes.
Do I have 3 eyes?
You have 2.
'Cause I see 3 things.
So I think what he's getting at here is that he's experiencing some double vision, and this can be as a result of the anaesthetic or some of the other medicines that you have when you're under sedation. The most common culprits are things like anti-sickness medicines. Again, the effects are short-lived, so his vision should just go back to normal.
I remember everything.
You remember everything?
I thought that the CIA, I was working for the CIA, and the CIA was gonna try to stop me from taking over the whole world.
Yeah, so CIA conspiracies, delusional thinking, and fantasy dreams are all the different types of things you can expect to play out when you're under mild sedation. Now, interestingly enough, before anaesthetics were anaesthetics, they were actually used recreationally, and I guess you can see why from some of these videos.
Wait, the eyes turn to water. My eyes are thirsty. Give them a drink.
They're thirsty?
Yeah.
Your eyes are thirsty?
Yeah.
No, not your eyes.
Wait, whoa. Whoa.
Stop.
So, my eyes are thirsty. Again, I think he's trying to tell them that he's got dry eyes, which can sometimes occur if your eyes haven't been taped shut. Now, about 6 out of 10 or 60% of patients don't naturally close their eyes when they go under a general anaesthetic. That means we need to tape them to help prevent damage to the cornea, causing things like a corneal abrasion.
Pepsi. The hospital has Pepsi. My lips need some chapstick.
So yes, she's got a dry mouth here, and this might be as a result of her having her mouth open during the surgery, or it could be due to the tape that's keeping the breathing tube in place. And there's nothing better than having a Pepsi Max or a boiled sweet to get the saliva flowing and moisten up those lips again.
Can I have this?
Yeah, you can have it.
What are you doing?
So it looks like she's going to be stealing those tissues.
Oh, she's stealing!
Oh, you better stop.
Oh!
And this is why we ask you to come in supervised for an anaesthetic. Now, an anaesthetic can be effective for up to 24 hours, so you really want to be supervised if you're going to be doing anything like driving.
Oh, God, wow. Oh, I was asleep.
Or going out shopping, because you wouldn't want to be caught shoplifting under anaesthetic.
What are you doing?
Drinking.
So yes, she's trying to coordinate drinking with this straw.
Check this out. I just invented it. Super straw.
And it's probably obvious by now, but the reason she's having trouble is the general anaesthetic is reducing her conscious level and the muscle relaxant is basically slowing down her movements.
Got a fucking dart in your neck. You're crazy, man.
This is why we give you a straw, so you don't pour the whole jug over your face or over the floor.
Did you give birth to me in a desk? Cause like, if you like put your feet on the desk, like it's a good way to give birth, and then the baby drops out into a basket.
So yeah, it's not uncommon that people say loopy things when they're under some sedation. Now the weirdest one I've heard is a patient say, "Can I get you anything whilst I'm out?" Let me know if you've heard any other stories like this.
I'm gonna start cooking meth. Jesse Pinkman, I'm gonna be Walter White and I'm gonna shave my head. And I'm gonna be bald like Walter White.
Okay guys, I hope that answered some of your questions about anaesthesia and surgery. Drop me a comment down below if there's anything else you want to know. Otherwise, I'll see you all in the next one. Thanks.